Going back to the all-on-4, I think one of the main reasons why patients come to the office and they don't understand why a single implant should be a lot more expensive than per se full mouth rehabilitation, full mouth reconstruction. When we do a single implant, we have all the natural teeth, we have a bite, we have to graft the area, or once we graft the area, we create sufficient amount of bone. We place the implant, we put the teeth would fit in with the current occlusion that the patient has.
Okay.
And it's a simple process. Frankly, it takes maybe 15-20 minutes to place an implant, another half hour, 45 minutes to restore the tooth, and patient has minimal chair time. When we go to full mouth rehabilitation, it's that we first have to extract all the teeth and remove all the infected tissue, infected root tips, all the infection tissue within the bone, clean up everything, graft the area, and then we come up with bone, basically with the empty jaw. So we can place all the implants, and that's going to be the base of what we are trying to accomplish. That's just the base. The implant is just the base. It's just the basically the pillars where we have to build the whole structure on top of. And now the second step is building a structure on those pillars that we created, or on those like in the building, like caissons. We put the caissons first, and then we put the building on top of it. Same exact thing. So now we have to make sure that the occlusion is perfect. It's the distance between the upper jaw and the lower jaw is correct. Because if my jaw is used to be closed at a certain angulation, at a certain height, at a certain distance between the upper and lower jaw, and all of a sudden we increase that space, then everything is going to collapse. Nothing is going to work. Patient is going to come up with a lot of jaw problems. The implants even will fail. So when we are doing a single implant, we don't have to really worry about that. So the reason why a single implant is not as complicated, or even 6 implants in a patient's jaw where everything else exists, yes, that's going to be 6 implants times X amount that we charge per implant. But when we go to a full mouth rehabilitation, we have to rebuild the patient's occlusion and the dimensions all from scratch, and that's a very complex process. It's just like you getting a website and you're fixing a corner of a website. Not that difficult, but now you have to go back and build this website from scratch. You have to develop the concept. After developing a concept, then you have to design, and then once you design, then you have to implement it. Same exact thing with dentistry. So the cost exponentially go up just because the amount of time we have to spend on this patient exponentially is higher than just one single implant. Again, 2 hours start to finish, chair time. A full mouth reconstruction, just a surgery date is about 6 or 7 hours, and then multiple visits, multiple post-ops, a final process, a lot of calculation on our end. So there you go. That's the reason why it's more expensive.
John, yes.